Welcome to The Mental Health Epidemic, Gen Z versus the World. This documentary explores the profound impact of mental health challenges on an entire generation, specifically how it's reshaping jobs, stifling creativity, straining healthcare systems, and raising crucial ethical questions. Gen Z, born between the mid-1990s and early 2010s, faces unprecedented mental health challenges. Studies reveal higher rates of anxiety, depression, and stress compared to previous generations, driven by factors like digital immersion, economic uncertainty, and global crises. This isn't just a personal struggle. It's a societal one with far-reaching consequences. The mental health epidemic among Gen Z is profoundly impacting the workforce. This isn't just about individual well-being. It's about the collective productivity and stability of our economy. Mental health struggles directly correlate with employment rates. Higher rates of anxiety and depression can lead to increased absenteeism, reduced productivity, and difficulty in maintaining stable employment, impacting both individuals and employers. Gen Z enters the workforce facing unique pressures. The demands of modern jobs, coupled with existing mental health challenges, can lead to burnout, decreased job satisfaction, and a struggle to meet performance expectations, creating a cycle of stress and underperformance. Mental well-being is intrinsically linked to our capacity for creativity and innovation. When mental health suffers, so too does our ability to think outside the box, problem solve, and generate new ideas. Mental health conditions can stifle creative expression. Anxiety can lead to self-doubt, depression can drain motivation, and chronic stress can impair cognitive functions essential for imaginative thinking. This impacts not only individual artists, but also fields reliant on groundbreaking ideas. When mental health struggles persist, the potential for innovation diminishes. It becomes harder to concentrate, to find inspiration, and to take the necessary risks that lead to breakthroughs. This has significant implications for scientific discovery, technological advancement, and cultural progress. The mental health epidemic among Gen Z is placing an unprecedented strain on healthcare systems worldwide. The demand for services is skyrocketing, and existing infrastructures are struggling to keep up. There's an ever-increasing demand for mental health services, from therapy and counseling to medication and crisis intervention. This surge is overwhelming resources, leading to longer wait times, limited access to specialists, and increased costs for individuals and public health systems. Despite the growing need, significant gaps in access to care persist for Gen Z. Many face barriers such as affordability, lack of insurance coverage, stigma, and a shortage of mental health professionals, particularly in underserved communities. This leaves many struggling in silence. The mental health epidemic also brings forth complex ethical considerations, particularly concerning treatment, data privacy, and societal responsibility. Ethical questions arise around the accessibility, quality, and appropriateness of mental health treatment. Who has access to the best care? How do we ensure that treatment is holistic and respects individual autonomy? And what are our responsibilities to support those struggling? In the digital age, mental health data privacy is a critical concern. As more people seek online support and use mental health apps, questions arise about how this sensitive data is collected, stored, and used. Ensuring confidentiality and preventing misuse is paramount. While the challenges are significant, there are tangible solutions and a hopeful outlook for improving Gen Z's mental well-being and building a more resilient future. Strategies include early intervention programs in schools, fostering open conversations to destigmatize mental health, promoting digital literacy for healthier online habits, and equipping young people with coping mechanisms and resilience skills. A multifaceted approach is essential, involving policy changes to increase funding and access to care, leveraging technology for innovative support tools, and fostering strong community networks that provide a sense of belonging and support. It requires a collective effort to build a future where mental well-being is prioritized for all.